Hi, I'm Denise Mourning. I'm a family nurse practitioner student at Texas State University, and today I'm going to go over a clinical breast exam. A thorough breast exam starts with a comprehensive personal and family history. If you were older than 35, a breast cancer risk assessment tool score would be obtained to estimate yours or any woman's risk of developing invasive breast cancer. You could also use the Gale model, or you could use the BRCA Pro model as well. The warning signs of breast cancer are not the same for all women. The most common symptoms are the change in the look and the feel of the breast, a change in the look or feel of the nipple, and nipple discharge. An assessment of a patient presenting with a breast symptom should include onset, associated breast symptoms, timing in relation to menstruation, and aggravation and alleviation symptoms. Screening recommendations for breast cancer vary by organization. At a very minimum, women ages 20 to 39 should be educated about breast self-examinations at every well visit and have a clinical breast exam every 1 to 3 years with your annual visit. A mammogram should only be performed on a woman that's 20 to 39 if something is found during the examination. Women that are 40 to 74 should have a clinical breast exam and mammogram annually. Women at higher risk may need to get screened earlier and more frequently than recommended. The optimal time for the clinical breast exam for premenopausal women is within the first 5 to 10 days after the onset of menses. You don't want to do it the week before or 2 weeks before, because you might have some cystic changes in your breast. So questions to ask for the personal and family history would include age at menarche, number of term pregnancies and the age you were at your first birth, lactation history, family history of breast or ovarian cancer, including effective relative, age of onset, and presence of bilateral disease on your maternal and paternal side, cultural ancestry, especially Ashkenazi Jews, history of breast biopsies, why you may have had one, history of breast surgeries, again, why you may have had it, environmental factors in your life, smoking, obesity, alcohol use, and then exposure to radiation. So in premenopausal women, you definitely need to know the date of the last menstrual period, use and any use of oral or hormonal contraceptives. In postmenopausal women, you would need a date of menopause. Then you would also want to know any of their screening practices, like if you do breast self-examinations, and again, any prior mammograms or other imaging. But because you're young, you probably would not have any of those done already. So any breast changes that we want to look forward to include lumps, pain, nipple discharge, changes in the appearance of the skin or nipples. And then before we start, you need to know that this clinical breast exam is going to include me visually looking at your breasts and then also palpating the breasts, okay? So while you're seated, I would inspect your breasts, obviously with no top on. Make sure there's no changes in the skin, no changes in the appearance. We would want to look for symmetry, although normal breasts are not perfectly symmetrical, but you would know that and you would be able to tell me that. Any changes in your nipple, changes in the tissue, any retraction in the nipples, and then of course any nipple discharge. So while you're sitting here, I'm going to ask you to hold your hands to the side. Sorry, my hands are a little cold. So I'm going to start by palpating in the axilla for the central lymph nodes, and I'm going to go pretty deep. And I'm going to palpate around, and you're going to let me know if you feel anything that's sore or, causing you any type of discomfort, And then I would work my way down the brachial lymph nodes on each side. And you want to use the pads of your fingertips on the first 3 fingers, and kind of light and then deep, light, medium, and deep pressure. And then I could also check her epitrochlear nodes, and then her supraclavicular nodes as well. Okay? And then at this point, I would have the patient lay down. And then I would have her raise her arm on the side that I'm going to palpate. And there's 5 things you need to remember when you're doing the breast exam. It is position, perimeter, pattern of search, palpation, and pressure. So position would be the patient lying down with the arm on the side that I'm examining up above her head. The perimeter would be mid-axillary line, inframammary ridge, up the sternum, and then all the way around. And I would go starting here with light pressure with my 3 fingertips, making small circular motions as I'm working my way up and down the breast. And again, if you're having any discomfort, please let me know. You haven't noticed any changes in your breast recently?
No.
Any changes in your nipple, like retraction of your nipple, or any type of discharge?
No.
Okay. Do you conduct a self-breast exam?
Sometimes.
Okay, so what's important about the self-breast exam is so that you know what your breasts look and feel like. So that if anything were out of the ordinary, you would know to come to your doctor immediately and report it so that you could do a clinical breast exam. And again, same with the clinical breast exam, you don't want to do the self-breast exam before your period. You want to do it either 5 to 10 days after your period, or you want to do it 5 to 10 days after your period starts, okay? So I've worked my way all the way around using various pressures around the breast. Some people also do a similar breast palpation while the patient's sitting up so that you can do it both ways. The important thing is to make your way around the entire breast using the light, medium, and deep palpation, and then you would do it again on the other side. Physical and visual findings include dimpling of the skin, changes of the skin or the areola or the nipple, changes or inversion of retraction, nipple discharge, associated tenderness, the presence or absence of any lymphadenopathy, which that's what I checked for when I was feeling when you were sitting up. For any breast mass, note position in the breast, the quadrant, the distance from the nipple, the shape, smooth or irregular borders, consistency, discrete or indistinct thickening, mobility, attachment to the skin, or deep structures. Breast self-exam is endorsed by the NCCN and the ACOG. Breast self-exam is beneficial for all women to become familiar with the normal appearance and feel of their breasts and report any changes promptly to their primary care provider. The clinical breast exam provides an opportunity to teach the patient breast awareness and the following signs that should be reported regardless of whether the patient has had a recent negative clinical breast exam or a mammogram. So anything you need to report to me from finding in your self-breast exam would be a new lump or mass in your breast or the axilla, swelling of any part of the breast, skin irritation or dimpling, breast or nipple pain, nipple retraction, redness or scaliness or thickening of the skin of the nipple of the breast, or nipple discharge other than breast milk, but you would know if you had that. A little deeper, and then I would also concentrate on the nipple if the patient was undressed, and just a little bit of squeeze so to make sure there was nothing coming out or it didn't cause you any pain. And this concludes. Do you have any questions? Okay, this concludes my clinical breast exam.